Canada's health ministers, by the way, were meeting in Banff when they got the news of this case in the United States. They are pointing out that the chance of Ebola spreading to Canada is very remote. With that in mind, we contacted Dr. Michael Gardam. He's an infectious disease expert at the University Health Network in Toronto, and I began by asking him how concerned we should be here in Canada.
Well, this kind of news is always concerning. I mean, we've known with the way that these outbreaks have been spiraling completely out of control in West Africa that it was honestly a matter of time before somebody managed to make it to North America. So this is the first case of that. I hope it's the only case, but again, with the outbreak out of control, we have to be prepared for things like this.
And is it possible, do we have the right level of vigilance that we need at our borders for people coming back from West Africa?
You know, right now it's generally recommended that we're not doing a lot of border screening because actually screening within Canada really doesn't work. We learned that during SARS. Really, you need to screen at the countries where people are leaving, and then it's really important to screen at the healthcare setting. So here in Canada, a lot of our emphasis has been put on making sure that the healthcare community is very aware of what's going on, and the second somebody presents with worrisome symptoms and has a travel history, that they would be immediately diagnosed as possible Ebola and isolated.
And so let's talk about that for a moment. Is it just people who have been to West Africa recently, if they have certain symptoms, they are the only ones who should have a kind of high degree of concern and head in and see a doctor?
I mean, honestly, the way things are working right now is the travel history to West Africa. If you have travel history and you're within the incubation period, like a reasonable incubation period, that kind of trumps everything else. So even we've heard many stories of people who have come from that part of the world who have symptoms that really don't sound anything like Ebola, but they're still isolated and still being tested because we're being extra cautious. Obviously, if somebody comes in with a sore toe, you don't want to test that person, but any symptoms that are even remotely possibly could be related to Ebola, those people are being isolated and they're being tested.
And every once in a while we hear stories in Canada either officially confirmed by hospitals or just rumors swirling around that somebody's in this hospital or that hospital with, they're being checked out for the possibility of Ebola. How concerned should we be when we hear those stories?
I think we actually should take some comfort from stories like that. It means we're actually looking for it. And again, we haven't had any stories like what we're hearing out of the United States today. The people that I'm aware of are people that really did not have good histories for Ebola, either because they weren't in the right part of the world or because they really didn't have compatible symptoms, but were being extra cautious. Nobody wants to obviously miss a case of infection with this virus.
And I don't know who was in the plane with the person who has the confirmed case in the United States, whether they're people that ended up in Canada. How concerned or the people at the airport for that matter, how concerned should they be?
I mean, my understanding from what I've been able to hear from the CDC press conference is that this person developed symptoms once they were already in the U.S. So everything we've learned from Ebola going back to 1976, it all says that Ebola is not something you catch prior to the onset of symptoms. Basically, the viral titers in the blood and the symptoms kind of go along sort of right next to each other. So without symptoms, we really don't worry about those contacts. We worry about the people this person was in contact with when they developed symptoms. And my understanding from the CDC press conference, unless I got it wrong, was there was probably a day or two between the onset of symptoms until when they were actually isolated for Ebola. So the CDC is going to be focusing in on that particular window and following up every single possible contact of that individual.
Dr. Gardam, really nice having your guidance on this. Thank you.
Thanks for having me.